Hi everyone, I am Roslyn Anita, Nursing Tutor in Tribulum College of Nursing. I discuss regarding infrared radiation. Objectives, Introduction, Definition of infrared radiation, list the types of infrared radiation, enlist the indication and contraindication of infrared radiation, discuss the physiological effects of infrared radiation, explain the therapeutic effects of infrared radiation, enumerate the production of infrared radiation, discuss the absorption and penetration of infrared radiation, explain the application of infrared rays, preparation of articles, preparation of patients, explain the procedure of infrared radiations, discuss aftercare of infrared radiation. Introduction. Infrared radiation or thermal radiation is a band of energy in the complete electromagnetic spectrum. Infrared radiation or the radiations of longer wavelength than the red end of the visible spectrum and extend to the microwave region from 760 nanometer to 1 millimeter. Infrared radiation is generated by sun. Many ancient therapies have utilized sunlight for wound healing and pain relief. When sun rays reaches the ground, they get absorbed by gases or water molecules in the atmosphere. The human body is made of 70% water, so it can potentially accumulate a large amount of energy that could modulate biological process by strong resonant absorption of infrared radiation from sunlight mediated by water molecules. Definition. Infrared radiation is long or visible rays of spectrum used therapeutically for the production of heat in the tissues. It is an electrical device which emits infrared radiation. Purposes: to promote comfort, to soften connective tissues, to promote of healing of bed sore, to improve circulation, to relieve spasm and pain, to promote suppuration, to relieve congestion in deep organs. Types of infrared therapy. Type: wavelength, photon energy. Infrared radiation A. Near infrared radiation, wavelength is 0.7 to 1.4 mu m, that is 700 to 1400 nanometer. Photon energy is 215 to 430. And type infraradiation B, that is mid infrared radiation. The wavelength is 1.4 to 3.0 mu m, that is 1400 to 3000 nanometer. The photon energy is 100 to 215. Type 3, that is infrared radiation C, far infrared radiation. The wavelength is 3.0 to 100 mu m and 3000 nano m to 0.1 millimeter. The photon energy is 3 to 100. Indications: pain, muscle spasm, joint stiffness, inflammation, muscle skeletal trauma ortho conditions like low back pain, osteoarthritis, rheumatoid arthritis, sprain, strains, muscle tear, capsulitis, tendinitis, frozen shoulder, traumatic arthritis, ankylosing spondylitis, and chronic bed sore. These are the indications. Next, we seen about contraindications. Malignant area, impaired sensation, advanced cardiac diseases, eczema, dermatitis, impaired circulation, edema, varicose vein, hemorrhagic conditions. Next we see on physiological effects, that is local cutaneous vasodilatation due to the release of chemical vasodilator histamine, as well as possible effect on the blood vessels occurs after 1 to 2 minutes. Evident erythema, the rate and intensity of erythema depends on rate and degree of heating. Reflex dilation of other cutaneous vessels occur to maintain normal heat balance. So prolonged heating leads to sweating and eventually to cooling. Therapeutic uses: pain relief, decreases muscle spasm, increase the sensory nerve conduction velocity, increase in endorphins influencing the pain gate mechanisms, acceleration of healing and tissue repair pressure source, used prior to electrical stimulation, that is testing or biofeedback to make the skin a better conductor. Production of infrared. Non-luminous generator. What is non-luminous generator? It is an electrical current is passed through a coil of wire wound on an insulating material like procalin, fire clay, which produce heat. The infrared emitter is placed at the focus of parabolic reflector to reflect the radiations in a uniform beam. The heated wire and heated material emits IR. Non-luminous requires some time to heat up before the emitted rays reach maximum intensity, and so must be switched on at an appropriate time prior to use. So the voltage will be non-luminous is 750 or 1000 volt. Luminous generator. Coming to the luminous generator, infrared is produced by incandescent lamps in the luminous generator. The lamp consists of a wire filament tungsten enclosed in a glass bulb that may be evacuated or filled with an inert gas at lower pressure. When an electrical current is passed through the tungsten filament, it gets heated and emit infrared, visible and few ultraviolet rays. The front of the bulb is red to filter out shorter visible and ultraviolet rays. The luminous 600 to 1500 volt. Next, coming to absorption and penetration of infrared. Some rays are reflected from the skin surface. Some penetrated in the skin, get scattered, reflected, and ultimately absorbed in tissues. Water and protein in the tissues strongly absorb infrared. Research suggests penetration of infrared depends on the structure, vascularity, pigmentation of the skin, and wavelength of the rays. Penetration depth is the depth at which approximately 63% of radiation energy is absorbed. For infrared rays penetrate up to 1.5 inches almost 4 centimeters beneath the skin. Application of infrared. Patient is placed in a comfortable position and area to be treated is exposed. Nature and effects of treatment are explained to the patient. The skin is examined and thermal sensation are tested. Eyes are shielded in case they are irradiated. To achieve the maximum penetration, the lamp is placed at right angles to area to be treated. So the distance from the lamp can be about 60 to 75 centimeter for large lamp, 750 to 1000 volt, and 45 to 15 centimeter for smaller ones. Intensity of heat is controlled by altering the position of the lamp, or in the some lamps by altering the resistance, thereby the current to the element. Non-luminous lamp has been switched on up to 15 minutes before application to allow the maximum emission. For acute cases, irradiation with infrared rays can be given for 10 to 15 minutes daily for 1 to 3 times as being the requirement. For chronic cases, up to 30 minutes once daily or on alternative days can be given. Preparation of articles. Actions and purposes. Infrared lamp. Purposes to provide heat therapy. Inch tape to measure the length between the light sources and patient. Top sheet to provide privacy to the patient. Goggles to protect eyes. Preparation of patients. Identify the correct patient and check the order to avoid error. Explain the procedure to the patient to win the cooperation of the patient. Advise the patient not to touch the face the light. Check the purpose and complication to avoid complications. Coming to procedure. First, you have to wash the hands to prevent the cross infections. Expose the area to which the heat to be applied with adequate privacy to ensure comfort. Position the patient according to the treatment to achieve the appropriate effect. Apply the goggle to the patient to protect the eyes. Place the lamp at the distance 45 to 55 cm, that is 18 inches, to avoid secondary effects and complication. The duration of treatment is usually 20 minutes. Discontinue the treatment if not tolerated by the patient to prevent cross infection. Aftercare. Check the skin condition for burns and redness and discomfort. Position the patient comfortably. Replace the articles in appropriate place. Record the procedure with the date, time, durations, and signs and symptoms observed after the procedure. Coming to conclusion, the use of infrared radiation represents a valid alternative to surgical lifting but cannot replace it. The infrared light techniques used as turn out to be useful in contrasting skin laxity of the face and other part of the body. References: Basis of Electrotherapy, Clayton 9th edition, Textbook of Electrotherapy, and www.script.com, Electrotherapy Evidence Based Practice, that is 12th editions, Shelia Kitchen. Thank you.